Now I have the pleasure to introduce Dr. Michelle Cordoba Kissee. Dr. Cordoba Kissee is a board certified in internal medicine with specialty certification in endocrinology, diabetes, and metabolism. Dr. Cordoba Kissee completed her undergraduate degree in biology, Spanish, and zoology with comprehensive honors at the University of Wisconsin-Madison, where she also attended medical school. She completed her residency training in internal medicine and a fellowship in endocrinology at the University of Arizona. She is fluent in both English and Spanish, and she battles against diabetes through innovative approaches to clinical care and patient education here at DHR. Please help me and welcome Dr. Michelle Cordoba Kissee.
All right, good morning, everybody. My name is Michelle Cordoba Kissee, and I think this is the first conference I've spoken at in like 2 years. So it's such a pleasure to be back in person. Everything for 2 years has been on Zoom or whatever, so welcome. And today I'm going to talk just a little bit about obesity and diabetes in the Rio Grande Valley. So these are our objectives. We're going to take a look and see if we can define obesity, type 2 diabetes. We want to describe the impact of obesity and type 2 diabetes in the Rio Grande Valley, and then discuss potential next steps to address the obesity and diabetes epidemic locally. Like Dr. Rao was saying, how do we tailor our approach to people that live here in our community? Oh my goodness. So the first part will be obesity. And to start out with, what is obesity? I think all of us kind of have an idea, more or less, what is obesity, but ¿qué es la obesidad? When somebody says that they have obesity, what does that really mean? So to define obesity, it's actually the abnormal or excessive fat accumulation that may impair health. And I think that that's important. I know there's a lot of times about body image, oh, he's just like gordito, it's okay. But we really need to think about, as people gain weight, how does that impact our health? So, ¿qué es la obesidad? Es una acumulación anormal o excesiva de grasa que puede ser perjudicial para la salud. So what does that mean, like, scientifically? So if I have a patient in my clinic, how can I tell if they're obese? How can you tell if you have obesity? What about your parents, your siblings? What does that mean? So one tool that we use every single day in clinic is this table. So to figure out, do you have obesity, this will tell you your BMI. And what you want to look for is, what is your height on the column on the left, and then go across the row on the top to look for your weight. So you find the intersection of your height and your weight, and that will give you your BMI. But what does that mean? So to classify different stages of obesity, that is based on your BMI. So if you can see for your height and your weight, if your BMI is over 30, that meets the criteria for obesity. And it's interesting because multiple studies have shown that even doctors don't do this very well. If you just eyeball your friends, you might say, oh, no, that person doesn't have obesity. But this is a scientific way to sort of look at numbers and say this person has obesity or they don't. Because a lot of times, depending on what you're wearing or the way you're sitting, you can't tell if somebody has obesity till you look at the numbers. So what are the complications of obesity? And I think if I asked all of you, you'd probably come up with a couple answers. So things like heart attack, stroke, maybe family members who are on dialysis. Those are all typical complications of obesity. Pero ¿cuáles son las complicaciones de la obesidad? A lot of times we don't think about other complications. So the ones I wanted to highlight that a lot of times we don't think about is cancer. So how many of us think about if we have loved ones who have obesity, we might not realize that that puts that person at risk for cancer. So for example, if you have a grandma who had breast cancer, you think, oh, she had breast cancer, but why did she get breast cancer? Was it because she was at increased risk because of obesity? So there's several different types of cancer that we know can be caused by obesity. Similarly, We have depression. So that's another thing, mental health. So if we have family members who are struggling with their mental health, we don't necessarily think like, oh, this person has depression because of the obesity. If we treat the obesity, maybe the risk of cancer goes down, maybe the depression gets better. And then I talk about this one a lot in my clinic, fertility. So we don't a lot of times think about, as we're gaining weight, how does that affect our future chance of having children? In both men and women, as people gain weight, it makes it more difficult to conceive children just because you can run into problems like with your hormones and things like that. So again, I think obesity probably affects a lot of other health problems besides just heart attack and stroke. And so it's important to think, well, if we treat obesity, are we actually preventing cancer, depression, fertility problems? Like Dr. Rao said, let's bring this back to the Valley. So when we look at the RGV, let's look at the percentages of people with adult obesity, and this is by county. So you can see here in Hidalgo County, 38% of the adults have obesity. So that's more than 1 out of every 3 adults. Cameron County is a little bit lower, 31%, and then Starr County is at 32%. Compared to the whole state, which is at 31%. So when you look at Texas, compare it, when you look at the Rio Grande Valley, compare it to the rest of Texas, we have more obesity here. And that's shown by this, where you can see here, these data are a little bit different, but this is saying 41% of adults have obesity in our region there in southern Texas. So again, when you look at the rest of Texas, unfortunately, we're the highest. So let's talk about diabetes. And I think diabetes is something that all of us know something about. All of us have maybe a family member, friend, an aunt, teacher with diabetes. But I also think a lot of us don't really understand or know that much about what is diabetes. So let's think about what is type 2 diabetes. So that occurs when the blood glucose, also called the blood sugar, is too high. We all make insulin, which is a hormone made by our pancreas that helps the blood sugar get into your cells so you can use it for energy. The problem with type 2 diabetes is that your body, as you get larger and larger with obesity, can't keep up with the need for insulin to get that sugar in the cells. So as you gain weight, you're not able to make as much insulin, the amount of insulin needed to lower your blood sugar. You actually make a lot more insulin, you just keep making more and more and more and more, but you get insulin resistance. So you probably know people that get darkness in their neck or their armpits. That's letting us know that darkness is caused from insulin resistance because the body's trying to fight to keep those blood sugars down. And then too much glucose stays in your blood and it doesn't reach your cells. So the problem is if you have these high blood sugars circling around in your blood, that's going to cause damage. And we'll talk about the organ damage in a little bit. So, ¿qué es la diabetes tipo 2? And this is pretty much what I just said. So, ocurre cuando la glucosa o el azúcar de la sangre está demasiado alta. La insulina es una hormona hecha por el páncreas y ayuda a la glucosa a entrar a las células para utilizar la energía. Con la diabetes tipo 2, el cuerpo no produce insulina suficiente o no la utiliza bien. Y demasiado glucosa se queda en la sangre y no alcanza a las células. So the way that I like to explain this to my patients is that the insulin is like keys. So we're making keys from our pancreas to help the sugar, the glucose, get into the cell. So keep this in mind, we'll come back to it, but this is when things are working. You have insulin, it unlocks the cell, and the glucose, the sugar, gets into the cell. So let's look at the prevalence of diabetes here in the Valley. And by county, we can see, again, that Hidalgo County has about 11%, Cameron County 12%, and Starr County 12%. So this is looking out of all the adults in these counties, what percent have diabetes compared to the whole state of Texas, which is 10%. So 1 out of every 10 adults in Texas has diabetes. Now these numbers are getting higher, and we'll talk about the ultimate risk of all of you getting diabetes in the future unless we change. And I would argue that these are probably way too low, because think about how many people probably have diabetes and they don't know. So how are diabetes and obesity related? What does one have to do with the other? So as we mentioned before, as people gain weight, the obesity can lead to that insulin resistance. So remember, we're making those keys to try to get the sugar into the cells, but as we get bigger, the keys are not working. And so when the insulin starts to get resistant, that causes the blood sugar to go up because it can't get into the cells. And it's really that sugar that's floating around in your blood that causes damage. So think about it. You have sugar kind of sticking to your kidneys, your nerves, your eyeballs. All the problems that can be caused by diabetes is from the high blood sugar. The sugar is very damaging to organs. So let's go back to this. And let's say you start gaining weight. So you're gaining weight, gaining weight, gaining weight. What happens is that key doesn't work anymore. You have insulin resistance. That's when you start to see the brownness on your neck, your armpits, you're gaining weight, periods start to get irregular. And so with that insulin resistance, man, your body's trying to keep up. It's making more and more and more keys. But with the insulin resistance, the keys aren't working. So you have high levels of insulin followed by high levels of blood sugar, and the blood sugar is what's going to damage your organs. Okay. So, ¿cuáles son las complicaciones de diabetes? So you can see, if you think about your family members that have diabetes, it's pretty rare. You don't hear somebody say, oh, well, they died from diabetes. No, what do people from diabetes, what are their problems? So things like dialysis, heart attack, we can see here fatty liver. I think Dr. Membrano's here. He's probably going to talk about that. We all know that it's really important to take care of your feet because, again, these high levels of sugar can affect los nervios, la boca, el corazón. It can give us complications because that sugar is toxic to our organs. So that's kind of depressing. So what can we do? What can be done? So the reason I'm here, the reason Dr. Trevino's here, Dr. Rao's here, is there are things we can do. What are some things what are the next steps? And so I know I only have 30 minutes, so I can't talk forever. So I picked 3 things that I think we can focus on. Starting with breastfeeding and childhood obesity. So I think a lot of us know family members who, in their 60s or 50s are diagnosed with diabetes, they have heart attacks, they have dialysis, but how can we prevent that? At that point, once somebody's on dialysis, a lot of damage has already been done to the body. We should be focusing on children and babies. How do we start young to make sure that people never get to the point where they get diabetes and have these problems? One easy target is breastfeeding. So I talk a lot about the metabolic benefits of breastfeeding. And so it's really important that we encourage breastfeeding. Babies who are breastfed have lower rates of obesity. Breastfeeding is good for the mom. It helps her return to a normal, healthy weight after pregnancy. And also, if you breastfeed, you have a lower risk yourself of type 2 diabetes, high blood pressure, breast cancer, ovarian cancer, osteoporosis, and arthritis. So a simple intervention that I think we don't think about a lot. Oh, are we going to give chichi or a bottle? It doesn't matter. But think about, I think if we as a community could encourage breastfeeding, we'd see a very positive metabolic impact. And so how are we doing in Texas? So with La Lactancia in Texas, breastfeeding at birth is good. We can see starting out at the top there, breastfeeding at birth, about 75% of moms at least try breastfeeding. That's pretty good. The problem, though, is when we fast forward to 12 months, it drops down to only 22%. So if you ask me, what is a way that we as a community can address obesity and diabetes, that right there. If you can encourage our community to breastfeed, continue breastfeeding, that's a low-risk, cheap way to intervene and help prevent diabetes. One thing that is good is, like Dr. Rao mentioned, our community is primarily Hispanic, and in the state of Texas, people of Hispanic descent have higher rates of breastfeeding than people who are white or black people. So that's good. We have that positive in our community that we should encourage breastfeeding among Hispanic moms. So take-home point would be the promotion of breastfeeding can reduce the risk of diabetes for both the mother as well as the baby. La promoción de la lactancia puede reducir los riesgos de obesidad y diabetes tanto para la mamá como el bebé. So moving on, baby grows up a little bit. Childhood obesity is also associated with all of those health problems. Oh my goodness. And so, unfortunately, it's getting worse. As you can see, the orange line is the more recent data, and you can see that childhood obesity rates at each grade is higher now than it's been in the past. So we need to focus on obesity prevention starting in childhood. Tenemos que enfocarnos en la prevención de la obesidad desde la niñez. So moving on to point 2, I think this is exciting. This is what I do all day, every day, and it's advances in weight loss and diabetes management. So I know Dr. Rao was talking about medications. These are really technical things that I put up here, but 2 examples of how clinical research has changed my job completely would be number 1, SGLT2 inhibitors. So this is a class of medication, I would say it was probably approved maybe 10 years ago. Same thing with the GLP-1 agonist. Maybe 10 years ago, probably a little bit longer, maybe 12 or 15 years ago, these were approved and they changed the landscape of diabetes. Before this, we were giving everybody insulin, they're gaining weight, kind of worked. But these medications are incredible. They help our patients control their blood sugar. They result in weight loss. They're good for the heart. They're good for the kidneys, probably good for the liver. So now we have these tools in diabetes. So even if you have family members who are like, ni modo, there's nothing I can do, I have diabetes, have them come see us. We have new medications that we can start that can change their lives. The other thing is now we know a lot about screening for blood pressure, cholesterol, kidney and eye disease. So we don't let our patients, if you come in and see us, we don't let you get amputations, go blind, dialysis. We will get on you, give you these medications, start screening you, have you lose weight so that you don't end up with the complications of diabetes. So most patients who are diagnosed today with diabetes and have regular follow-up with their doctors can expect to live a long life with minimal complications from diabetes. La mayoría de los pacientes diagnosticados hoy con diabetes y que tienen citas regulares con sus doctores puede contar con una vida larga con mínimas complicaciones de diabetes. So one thing I also wanted to bring up is metabolic surgery. I work in a metabolic surgery center. And I know there's that show on TV, My 600-Pound Life, and I think that's good because it increases awareness of metabolic surgery, but I also think it's bad because it paints like a certain picture of people who are getting metabolic surgery, and that's not at all what we see. So here in the Rio Grande Valley, our surgeons do operations on many people who are not that obese, because they want treatment, permanent treatment for their diabetes. So again, if you have family members who are like, what else can I do for my diabetes? I'm sick of taking medications. For many of our loved ones, metabolic surgery, and you can see the 2 types there, are great ways for many people to permanently reverse their diabetes. So metabolic surgery can be a permanent treatment to get rid of diabetes and improve obesity. Y oh, sorry, I said last, but la cirugía metabólica puede ser un tratamiento permanente para deshacerse de la diabetes y mejorar la obesidad. So finally, let's talk about research. And like I mentioned before, research is really important because me being a clinician, a doctor, without research, what can I do? I mean, tell you to go take a run? Like, we need to continue having research going on so we can offer the best tools possible to our patients. So when we look at, like Dr. Rao mentioned, I didn't know he was going to present this, but we know that we have high percentage of people of Hispanic descent in our population. So, you know, Hidalgo County is 92.5% compared to the state of Texas overall, 97%. And obviously, if you compare these numbers to the United States, the percent of people of Hispanic descent in the United States is much lower. So what does that mean specifically for diabetes? So diabetes in somebody of Hispanic descent and somebody of non-Hispanic descent, in my opinion, are two different diseases. And when I moved here, I moved from Tucson, and we had a lot of people of Hispanic descent in Tucson. But man, I got burned when I moved here because I was taught a certain way of diagnosing and treating diabetes, and I started doing that here, and it did not work well at all. It took me about a year to figure out, this doesn't work in this population, but this does. And so, like Dr. Rao mentioned, it's really important that we have the studies to show what is best for our population, what works best for people who have similar genetic properties. So when we look at the risk of developing type 2 diabetes over a lifetime, in general, in the United States, that's high, 40%. So it's getting worse, right? As you grow up, 40% of US adults will develop diabetes in their lifetime. It's almost half. But what if you're of Hispanic descent? Even worse. So people who are Hispanic or Latinx adults have over a 50% chance of developing diabetes. So that means if you're of Hispanic descent, you're more likely to get diabetes than to not when you're an adult. The other thing is, like I said, diabetes is more likely, it's very different in people that are Hispanic, so more likely to develop at a younger age, and they have higher rates of kidney failure and diabetes related vision loss. So even if you and your friend have diabetes, if you're of Hispanic descent, you're more likely to get it younger and have way more problems. So we know that diabetes affects people of Hispanic descent differently. We need to make sure that people of Hispanic descent are represented in our clinical trials. So it's important that our community continues to be represented in clinical trials for obesity and type 2 diabetes, and the results of these clinical trials help us provide the best care of our patients. So if you're looking at this and saying, oh my goodness, I have a 50% chance of getting diabetes, now is the time we can change that. So that 10 years from now, I'm like, oh, remember when we used to say it was 50%? It's now down to 35%, and it's getting better. So es importante que nuestra comunidad continúe a ser representada en ensayos clínicos para la obesidad y diabetes tipo 2. Los resultados de los ensayos clínicos nos ayudan a proveer los mejores cuidados para nuestros pacientes. So these are the kind of 3 take-home points I'd like you to think about when you're thinking about what can we do here in the Valley for diabetes and obesity. All right, thank you so much.